Preparing for labor and delivery is an important part of your pregnancy journey. Knowing what to expect can help ease anxiety and ensure you're as ready as possible for the big day. Here's what you should know before you go into labor. Number 1. Understand the stages of labor. Labor is typically divided into 3 stages. First stage, early labor. This stage starts with the onset of regular contractions and lasts until your cervix is dilated to 4 to 6 centimeters. Contractions may be mild and irregular at first but gradually become more regular and stronger. This stage can last several hours or even days, especially for first-time mothers. Active labor. Your cervix dilates from 4 to 6 centimeters to 10 centimeters. Contractions are stronger, more regular, and closer together. This stage typically lasts 4 to 8 hours but can vary widely. Transition. This is the most intense phase, where the cervix fully dilates to 10 centimeters. Contractions are very strong and close together, but this stage is usually the shortest, lasting 30 minutes to 2 hours. Second stage, pushing and delivery. This stage begins when your cervix is fully dilated and ends with the birth of your baby. It can last anywhere from a few minutes to a few hours. You'll work with your healthcare provider to push with each contraction until your baby is born. Third stage, delivery of the placenta. After your baby is born, your uterus will continue to contract to expel the placenta. This stage usually takes 5 to 30 minutes. Number 2. Know the signs of labor. Be aware of the key signs that labor is starting. Regular contractions. These contractions are strong, come at regular intervals, and gradually get closer together and more intense. If they follow the 5-1-1 rule, every 5 minutes, lasting 1 minute, for at least 1 hour, it's time to head to the hospital. Water breaking. The rupture of the amniotic sac can be a sudden gush or a slow trickle of fluid. If your water breaks, contact your healthcare provider immediately. Bloody show. The discharge of the mucus plug, which may be tinged with blood, can signal that labor is approaching. Back pain and pelvic pressure. Some women experience intense lower back pain or a sensation of pressure in the pelvis as labor begins. Number 3. Create a birth plan. A birth plan is a document that outlines your preferences for labor and delivery. While flexibility is important, a birth plan can help communicate your wishes to your healthcare team. Consider including pain management preferences. Whether you prefer natural pain relief methods, an epidural, or other medications. Labor and delivery positions. Your preferred positions during labor, for example, walking, sitting, squatting, and pushing. Who will be present? Who you want in the delivery room with you, including your partner, family members, or a doula. Medical interventions. Your views on interventions such as induction, episiotomy, or the use of forceps or vacuum extraction. Newborn care. Your preferences for newborn care immediately after birth, including skin-to-skin contact, delayed cord clamping, and breastfeeding. Number 4. Pack your hospital bag. Having your hospital bag packed and ready will make it easier when the time comes. Consider including, for you, comfortable clothing including a robe and slippers, toiletries, maternity bras, nursing pads, a phone charger, and any necessary paperwork, ID, insurance card, birth plan. For baby, a few onesies, socks, mittens, a blanket, and a going-home outfit. For your partner, snacks, a change of clothes, toiletries, and any items they need to be comfortable during labor. Number 5. Understand pain relief options. There are various pain relief options available during labor, ranging from natural methods to medical interventions. Natural pain relief. Techniques like breathing exercises, massage, hydrotherapy, and using a birthing ball can help manage pain. Epidural. An epidural is a common form of pain relief that numbs the lower half of your body while keeping you awake and alert. It's effective but may limit your ability to move around. Other medications. Options like nitrous oxide or 4 pain medications can take the edge off contractions without fully numbing you. Discuss your pain relief preferences with your healthcare provider ahead of time, so you're prepared for what to expect. Number 6. Know what to expect post-delivery. After your baby is born, you'll enter the postpartum period, which involves recovery and adjusting to life with a newborn. Physical recovery. You may experience cramping, bleeding, and soreness as your body heals. Rest and self-care are important during this time. Breastfeeding. If you plan to breastfeed, your healthcare provider or a lactation consultant can offer guidance and support. The first few days can be challenging as you and your baby learn together. Emotional changes. It's normal to experience a range of emotions, from joy to anxiety to sadness. If you're feeling overwhelmed, reach out to your healthcare provider, especially if you suspect postpartum depression. Number 7. Know when to go to the hospital. It's important to know when it's time to head to the hospital. Contractions. Follow the 5-1-1 rule, contractions every 5 minutes, lasting 1 minute each for 1 hour, or whatever guideline your provider recommends. Water breaking. If your water breaks, go to the hospital even if you're not having contractions. Heavy bleeding. If you experience heavy bleeding, severe pain, or any other concerning symptoms, go to the hospital immediately. Number 8. Be prepared for the unexpected. While it's great to have a plan, labor and delivery can be unpredictable. Be open to changes and trust your healthcare team to guide you through any unexpected situations. Whether it's a change in your birth plan, needing a C-section, or handling complications, flexibility is key. Number 9. Stay informed and ask questions. Knowledge is empowering. Take prenatal classes, read up on labor and delivery, and ask your healthcare provider any questions you have. Understanding what to expect can help you feel more confident and prepared. Number 10. Focus on self-care and support. Taking care of yourself in the weeks leading up to labor is crucial. Rest. Get plenty of rest and sleep to prepare for the demands of labor and postpartum life. Nutrition. Continue to eat a balanced diet and stay hydrated. Support system. Surround yourself with supportive people who can help you through labor and the postpartum period. Conclusion. Preparing for labor involves understanding the process, knowing the signs, planning for the experience, and staying flexible. By familiarizing yourself with what to expect and taking steps to prepare, you can approach labor with more confidence and peace of mind. Trust your body, communicate with your healthcare team, and focus on the exciting moment when you'll finally meet your baby.